Hello everyone, Dr. Mike here. Today, we're diving into the top indicators that help us understand the health of populations. These indicators are like puzzle pieces, each providing a unique perspective on the well-being of a society. By examining these factors, we can gain a deeper understanding of the health challenges and successes of different populations. So let's jump right in and explore these key indicators together. Let's start with standardized mortality rates, often referred to as SMR. Now, this indicator might sound a bit technical, but it's actually pretty straightforward. Imagine you're comparing the death rates of two cities, one with a much older population than the other. Simply looking at the overall death rates wouldn't give you a fair comparison, right? That's where SMR comes in. It levels the playing field by adjusting for age differences and other demographic factors. This allows us to make more accurate comparisons between different populations, regardless of their age structures. For example, a city with a higher SMR than expected might indicate underlying health issues or disparities that need to be addressed. So, SMR helps us see past the surface and identify potential health concerns within specific communities. This makes it a valuable tool for public health professionals working to improve the well-being of the people they serve. Now, let's talk about infant mortality rates, a crucial indicator of a population's health. This rate reflects the number of infant deaths per 1,000 live births, and it's a powerful measure of a society's overall well-being. Why? Because infant health is incredibly sensitive to various factors, including access to quality healthcare, socioeconomic conditions, and even environmental factors. A high infant mortality rate can be a red flag, suggesting potential issues with prenatal care, nutrition, or infectious disease control. On the other hand, a low infant mortality rate often indicates a strong healthcare system, good maternal health, and a supportive environment for families. Therefore, by tracking infant mortality rates, public health officials can identify areas needing improvement and work towards ensuring that every baby has a healthy start in life. Life expectancy, as you might guess, tells us the average number of years a person is expected to live. This seemingly simple statistic speaks volumes about the overall health and well-being of a population. A higher life expectancy often suggests better living conditions, access to quality health care, and effective public health interventions. Think of it this way: when people have access to good nutrition, clean water, and a safe environment, they're more likely to live longer, healthier lives. However, life expectancy isn't just about adding years to life, it's also about adding life to those years. A high life expectancy coupled with a high quality of life is the ultimate goal. This means ensuring that people not only live longer, but also enjoy those years in good health and vitality. Now, you might be surprised to see GCSE rates on our list of health indicators, but the truth is, education and health are intricately linked. Higher levels of education are often associated with better health outcomes. People with more education tend to have greater health literacy, meaning they're better equipped to understand and manage their health. They're also more likely to make healthier choices, have access to better jobs and healthcare, and live in safer environments. All of these factors contribute to a longer and healthier life. So while GCSE rates might not seem directly related to physical health, they provide valuable insights into a population's overall well-being and its potential for a brighter, healthier future. Let's address the elephant in the room: childhood obesity. This is a pressing public health issue with far-reaching consequences. We've seen a dramatic rise in childhood obesity rates in recent decades, and this trend has serious implications for the long-term health of our children. Childhood obesity increases the risk of developing chronic diseases like type 2 diabetes, heart disease, and certain types of cancer later in life. It can also lead to social and psychological problems, impacting a child's self-esteem and overall well-being. Addressing childhood obesity requires a multi-pronged approach, including promoting healthy eating habits, increasing physical activity, and creating supportive environments that make healthy choices easier for everyone. Smoking, as we all know, is incredibly harmful to our health. It's a leading cause of preventable death worldwide, and it contributes significantly to the burden of disease. High smoking rates within a population can lead to a surge in smoking-related illnesses, such as lung cancer, heart disease, stroke, and chronic obstructive pulmonary disease, or COPD. These conditions not only impact individual lives, but also place a strain on healthcare systems and economies. The good news is that smoking rates have been declining in many parts of the world, thanks to public health campaigns, smoking cessation programs, and policy changes. However, there's still much work to be done to further reduce smoking rates and mitigate its devastating effects on public health. We can't talk about health without addressing mental health, and depression rates serve as a crucial indicator in this area. Depression is a serious mood disorder that affects millions worldwide, causing persistent sadness, loss of interest, and a range of emotional and physical symptoms. High rates of depression within a population can indicate underlying societal issues such as stress, social isolation, economic hardship, or inadequate access to mental health services. Recognizing and addressing depression is crucial, as it not only affects individual well-being, but can also have ripple effects on families, communities, and the workforce. Promoting mental health awareness, reducing stigma, and ensuring access to mental health care are essential steps in tackling this often invisible health issue. Finally, let's talk about happiness. You might be thinking, happiness as a health indicator? But it's true. Happiness, or subjective well-being, is increasingly recognized as a vital aspect of overall health. Studies have shown that happier people tend to have stronger immune systems, lower blood pressure, and a reduced risk of heart disease. While happiness is influenced by various factors, including genetics and personal circumstances, it's also closely tied to social connections, community support, and a sense of purpose. Creating societies that prioritize well-being, social cohesion, and opportunities for personal fulfillment can contribute to greater happiness, and consequently, better overall health for everyone. These indicators give us valuable insights into the health of a population. By understanding these factors, we can better address health challenges, develop effective interventions, and create healthier societies for everyone. Remember, knowledge is power when it comes to health. The more we understand about these indicators and their implications, the better equipped we are to make informed decisions that shape our own health and the health of our communities. Don't forget to like, subscribe, and share this video for more health insights.